Hi, my name is Rachel Emery. I'm one of the nurse practitioners in the Women's Health Center at Logansport Memorial Hospital. I'm a part of the care team to support you in your breastfeeding journey. We also have a great team of lactation consultants that can help you both prenatally if you make an appointment with them or during a breastfeeding class. And they're also here to support you in the hospital once you deliver.
I'm Laura Adams. I'm one of the lactation team members here at Logansport Memorial Hospital. I will see you once your baby's born to help with those initial latches and first breastfeeding moments. I also teach a breastfeeding class which you can sign up for before you deliver your baby.
Hi, I'm Amanda. I'm an OB nurse and a lactation counselor here at the hospital. And my role is to be here for you during your breastfeeding journey while you're here in the hospital, and even to support you once you're at home for as long as you need.
So breastfeeding has many benefits to you and your baby. The big ones are it's the perfect nutrition for your baby. It provides antibodies to your baby within those first couple of weeks. Your baby's not going to have any kind of immunization, so it's going to provide that protection for them if they were to come into contact with bacteria or other infections. It also promotes bonding with you and your baby, and you still have bonding if you don't breastfeed, but breastfeeding and bonding is at another level.
Skin-to-skin contact is when your baby is placed directly on your chest right after delivery. We try to do that as soon as possible within the first few minutes after a vaginal delivery. Sometimes after a C-section it takes a little bit longer, but we try to do it before you leave the OR. We also don't give baby baths for the first 8 hours after delivery because we believe babies should be skin-to-skin or snuggled up on your chest bonding.
Skin to skin is good for bonding with your baby. It allows them to transition easily outside of the womb. It's very calming for mom and baby. It helps to regulate your baby's heart rate, respirations, blood sugar levels, and it just gets that first breastfeeding off to a good start.
So what is rooming in? Rooming in means that you're going to keep your baby with you at all times. The only reason your baby should be outside of your room is if it's a medically indicated reason for things such as breathing problems, or if your baby's going to have a circumcision. Those would be reasons we would want your baby out of the room. But any other thing that we do with your baby, such as the baby's bath, any kind of testing that we need to do, all of that can be done inside of your room. So we encourage you to keep your baby in your room with you at all times.
All babies are a little bit different, so having your baby with you in your room all the time helps you to learn their individual cues. It also is a little bit more helpful to be able to feed them on demand.
Exclusive breastfeeding means that your baby is drinking milk only from your breast and not drinking anything else, such as formula. There are some risks to introducing formula for breastfed babies. That can be that sometimes they have trouble latching. They tend to not want to eat as often, which can cause breast problems for mom and also lower milk supply. Once formula is introduced to a breastfed infant, it changes the lining of their gut, which increases their risk of infection, illness, allergies, going through childhood and even into adulthood.
There are so many benefits to breastfeeding as a new mom. So after delivery, if you breastfeed within that first hour, it really helps you to decrease your bleeding. So when you're breastfeeding, your uterus contracts, and that helps lessen the bleeding right after delivery. There's lots of other benefits, such as lower chance of ovarian cancer and breast cancer, and less chance of developing type 2 diabetes. There's also, it's free and convenient, so you can breastfeed anywhere, anytime. You don't have to get up in the middle of the night and make a bottle. So those are just some benefits to you as a new mama.
There are so many benefits to breastfeeding. Breastfeeding gives you and your baby a bond like no other. It also has the perfect amount of nutrients for your baby, it's flavorful, and it changes to meet your baby's needs as they grow. Breast milk also has lots of antibodies, and it helps to lower the risk of asthma, type 1 diabetes, and SIDS.
Your baby is going to show hunger cues when he or she is ready to eat. This can be anything from when they're first waking up, stirring, looking around like they're searching or rooting for something, their mouths are open, their tongues are going back and forth, or even just sucking on their hands and fingers. We encourage you to feed your baby when they're showing these hunger cues just to help prevent any breastfeeding complications, such as low milk supply, increased weight loss for your baby, or even jaundice.
So the best way to be successful with breastfeeding really implies position and latch. So in order to have good milk transfer, which helps your milk supply be adequate in those beginning few weeks, it really is indicative of proper positioning and latch. So in order to have a good latch, you need to have your baby in the best position. And then when all of that comes into play, you have decreased chance of nipple pain and nipple damage, which is a big risk with breastfeeding. And then also with all that comes a great milk supply and adequate milk transfer from your baby at your breast.
Breastfeeding is a learned behavior for both mom and baby, so educating yourself about it is the best way to be successful. We have a great lactation team here that can help you both before delivery and after delivery. There are breastfeeding classes that are taught by our lactation consultants, and that is a great place to start. After delivery, you can meet with them with your baby, and they can help you troubleshoot certain areas if you're having issues, or just help make sure you're successful while you're here still in the hospital.